Let's move on now to the rest of the day's news. As countries around the world try to deal with increasing cases of coronavirus, some general practitioners have raised concerns about the lack of support from state and the federal governments. Perth GP Dr Brett Montgomery has written a letter to the WA Health Minister criticising the minister's comments that it was inappropriate some GPs were rejecting patients concerned they had COVID-19. And Dr Brett Montgomery joins me now live. Doctor, good afternoon. Thank you so much for your time.
Thank you for having me.
Firstly, why did you feel that you needed to write to Roger Cook?
Well, I was concerned particularly by his reported comments that GPs who felt unable to see patients who were presenting worried about coronavirus, that in doing so, such GPs were breaching their legal and moral duties. I think on the legal front he's simply wrong about that, and I've had legal advice to that effect. But what concerned me more was the moral side of things. I don't know of any, I haven't rejected patients in that setting yet, but I know of GPs who've had to, who felt that they couldn't see those patients, and I don't think they were being immoral, I don't think they were being callous. I think they were balancing different moral interests. That is, that they want to see their patients, they want to look after their patients, but they also want to protect the wellness of patients in their waiting room and of their staff and of their families. So GPs, I think, are feeling underprepared because they don't have the personal protective equipment they need in order to safely see such patients.
And does this come down to a lack of resourcing from state and federal governments? Do you feel like GPs are not getting the support during this time that they need?
Yeah, I think a lot of GPs feel like that at the moment. In fact, there's an industry magazine, Australian Doctor, who this week polled GPs and said, do you feel like you've got the personal protective equipment you need? And some 90% of people said no. So it's not just my opinion. Yeah, I think state governments are responsible for hospitals, federal governments are responsible for general practice, and we've seen very little provision of personal protective equipment from the federal government into general practice. We have a little bit of our own, but general practices don't prepare for global pandemics. You know, we usually buy the gear we need to do our usual job.
Roger Cook did say that it is the legal obligation of a GP to see a person who could potentially be impacted by COVID-19. Is that the case? Is a GP required to legally see a person who's worried?
Look, my advice is that only in a setting of a true emergency, or if we, specifically have a specific workplace agreement, contractual obligation to do so, are we legally required to? No, we're not legally required to. But as I say, it's not the legal stuff that worries me so much. It is that sense that he was telling us we were immoral, when what we're actually trying to do is to choose the best path forward, protecting the health of the person we're seeing, but also protecting the health of the other people in our waiting rooms.
Overall, how swamped are GPs right now amid this coronavirus outbreak?
Well, look, it's early days. I don't think we're feeling swamped yet, most of us, but I think we're really worried about what's to come. The total number of cases in Australia is not yet large, but we look around the world, we see those cases multiplying, and we really want to be prepared. GPs want to play a role in helping with this. We want to do our part within the health system. We're not helped to do that when we don't have the gear we need to do it, and we're not helped when state health ministers make disparaging remarks about us. If the federal government comes to the party and helps us with equipment and helps us with funding for, where appropriate, doing consultations over the telephone, then we'll be better placed to do what we can. And I was critical of Minister Cook in my letter, but to his credit, I noticed a Facebook post he made yesterday which says that he had a teleconference meeting with other state ministers and the federal health minister on Friday, and that he did advocate in that meeting for the federal minister to help us with personal protective equipment and to help us with telehealth funding. So, credit where credit is due. I welcome his newfound advocacy for general practitioners, and it's now over to the federal health minister to see what happens next.
Doctor, there had also been suggestions of the introduction of a time-limited Medicare rebate for telehealth consultations to try and support general practitioners. From your perspective, is telehealth important during this crisis?
Potentially so. I mean, some people who are really sick are going to need to be seen in person and they're going to need to be seen in hospitals. But people with mild symptoms might just need advice about isolating themselves and direction to the safest way to get themselves tested. I think on balance it can often be quite appropriate to give that advice over the phone, because in doing so we're stopping people from coming to a practice and potentially sharing their bugs around. And at the moment Medicare funding for GPs is really pretty strict about only paying if you see people face to face. So in order to, and I don't think GPs are trying to capitalise on this and come up with a whole new revenue stream. We're not trying to cash in on this outbreak, but what we'd like to see is that we can keep doing our work, be a bit flexible about how we do it, and not either put patients out of pocket or take an income hit ourselves. We just want to do the work we do, keep getting paid as we do, and help people in the safest way possible. That doesn't involve unnecessarily calling people into practices.
Absolutely. Well, it's certainly been a difficult couple of weeks, and I'm sure that it's just going to get more difficult. Dr. Brett Montgomery, thank you so much for your time this afternoon.